Okay, the next thing we're going to do this morning, if I have your permission, is we're going to talk to the patients who just had surgery. And so those of you who are thinking about having surgery this morning, you still have a chance to back out. All right, let's see. Yesterday first was Helen, Donna, and Stephanie. And your surgery went great yesterday. We had no problems. We actually had a visitor watching.
Yes, that was so fun.
To make sure that I did everything right. And she's an ICU nurse, and I don't know if you've talked to her, but...
oh, yes.
Oh, did you? Yeah.
We gabbed in the hall while we were waiting. And then when they were prepping for surgery, we were talking. Wonderful. Well, for those who... Well, you all know that the whole family was here yesterday.
Right.
To the son and daughter and mom and dad, and just a great group of people. And her name was Stephanie, so we
right.
kind of hooked up just with that little deal. And she was very comforting, and then I went to sleep. And she told my husband that when I first woke up, I looked up at her and I had a smile from ear to ear. That's what she said. So I'm taking that because that's how I feel. I haven't had a lot of pain.
Good.
I would call it discomfort right about here and to the left side of my abdomen. And my throat is raspy, and I'm sure that's because of the tube.
Yeah, the plastic tubes that go back in there. There's not only the breathing tube, but there's another plastic tube about big around as your thumb that we pass down through there, and we use that as a guide to create the new stomach. And so that is kind of rough, and putting both those tubes down there can cause a little irritation. That should get better. So keep an eye on that.
Okay.
But yeah, one of the other nice things is Stephanie is an ICU nurse, and so she got to watch your surgery, and she was very pleasantly impressed, and she said some good things. I think it's nice to let her watch, and so it was a lot of fun for us to have somebody else watch and see what we do, and we're kind of proud of how easy it goes and how little bleeding there is, things like that. So it's good. Well, sounds like your night was kind of as expected. We're quite disappointed you had any pain at all, but did you use some pain medicine?
Yeah.
Good. All right, good. Did you use the pump, or did you ask for some extra from the nurses?
No, well, they gave me a pain shot this morning.
Did they? Okay.
And I used the pump
Good.
in the night.
And that was enough for you? Good. And you walked a little bit?
I walked a lot.
Good. That really helps. So we want to do that. How about drinking liquids?
I am doing best with water and ice.
Okay.
Chewing on that and crunching it up and just letting it trickle down. I'm not having any problem swallowing.
Okay.
And I've been able to take my pills orally, and I knew to go slow and space it out.
Exactly right. So she's saying some pointers for you all today. Sometimes the nurse will bring you a whole batch of pills, and so because our patients are very dutiful, they listen and follow instructions, they just take that whole thing and wolf it down, and that can cause sticking or filling. So slow and cautious are our guidelines. Take it very slow and easy. Sounds like you're doing that. And passing your urine?
Yes, I just started that this morning.
Good.
Actually, I guess last night, and that's just about all right now.
Good. Questions? Anything that we should talk about?
Citracel, in the manual it says wait 2 weeks. Okay.
Well, the Citracel and all the medicines are not critical. The most important way to think about this is it's a marathon, not a sprint. There's nothing that you need in today. Okay? Except for a little salt water. And even then, if you can't take any salt water in, and Gatorade is probably the best choice for that, is if you can't take any of that in, sometimes we have to use IV fluids. So see how that goes. But you can be surprised at just how powerful the surgery is, because you're going to lose so much salt water that you can get weak and tired. Now, most people who are heavy have water to give. In other words, you're edematous. You have extra fluid on board already. And so what we hope and pray and expect, the surgery will cause that fluid to come out of you the same way we might kind of squeeze out a sponge. We think your body is inappropriately retaining extra salt and water. That's the swelling in your ankles. It's the high blood pressure people get. It's the headaches people have from extra fluid in the skull. There's trouble breathing from fluid in the lungs. And you can just go down the list. All these things are made worse by being stuffed full of excess water. And we're going to wring that water out of you like we're going to wring out a sponge. That's good, but you can do too much of that. And if you saw people in the clinic yesterday, we heard a couple, or on Tuesday, there were a couple that actually had that. They were kind of weak and tired. Mary Ann, who was sitting right about there, was kind of a little unsteady, and that's an example of where the surgery is working, but it's working so powerfully it's kind of overdoing it. So back to your point of the Citracil. We don't need any Citracil now.
Okay.
There's a line from the Treasure of Sierra Madre with Humphrey Bogart where he meets up with the Mexicans and he says, "Where are your badges?" He says, "We don't need no stinking badges." Yeah, we don't need Citracil right now.
Okay.
Citracil for the rest of your life is going to be valuable. And we talk to you about it now because we have you here to talk to you. And a lot of our patients don't come back every day to get an opportunity for us to tell you more about that. So those medicines are not critical today.
Okay.
Today is a time of celebration.
It sure
Seriously.
is.
This is life and death surgery. Complications can happen, and you're doing great. So we feel good about that. Don't feel that you have to push anything except for a little bit of Gatorade if you feel weak and tired.
Okay.
That's really the key.
And when is it acceptable or allowable to shower?
You can shower today. And that's a good question because the answer is actually in the manual. So it's not a bad thing to ask that, but the manual is now going to be a tremendous resource for you. A lot of people view the manual as just a hurdle to get over.
Right.
You know, it's like I have to memorize this to get my license. But that question and a dozen others you haven't thought to ask are in the manual.
Okay.
And you're going to get from Sandy and Trish or Jennifer today, you're going to get another copy of the section in the manual that has all the discharge instructions. So there are questions in there like, how long do you wear the white stockings? You wear them until you're back to normal activity level. Okay. Is it chicken broth or chicken noodle soup?
Broth.
No, chicken noodle soup.
Oh,
You
noodle.
can have, yeah, you can have that.
Okay.
Do you have to have non-fat yogurt?
No.
No, right. So all that stuff, there's, if you have a temperature after surgery, when do you worry? It's when the temperature is above 101.5. So if you want to call before that, you may. But there's lots of stuff like that in there that you can look at. What if your pulse rate is 90? Is that concerning? Only if it's above about 120 does it kind of worry us.
Okay.
So there's all that kind of details all in there, which you have probably skimmed over because you were focused on the pre-op stuff because you wanted to get here.
Yes.
Well, now you're here. You graduated now, and now all that other stuff is not that important. But there's a whole bunch of stuff now because you bought the car for you to have the manual for the car.
Right.
And so that's what you want to look at. So your question's a good one. Any other questions?
No. I have, you told me to keep two meds, throw 2 away. The 2 meds were metformin and...
The metformin, well, how was your sugar?
It's a little bit higher, but...
It should be higher. Remember we talked about
yes.
the stress response. So do you
Right.
remember the numbers of any of your sugars?
Yesterday, before we left to come, it was 145, and I think this morning it was 156.
Okay. Now 156 would be abnormal, and it would bother us if you're going to have that way for the rest of your life.
Right.
We don't care about it today. We like it today. That's what's happy news. So we don't want you to take any metformin for that sugar because it might go to 40.
Okay, right.
Because I'm lowering your sugar, and I don't want any of the passengers for the jet to come in and help me fly.
Okay.
So you need to be careful. If you come and start driving this part of the jet while I'm driving the jet, we could go into the ground. And if your sugar's high today, I can deal with that. I can live with that. You can live with that. If your sugar is 40 today, you could fall down and hit your head, and you might not live with that.
Right.
So that sugar so far is okay. And remember, when you leave the hospital today, you're going to get a sugar, a sugar testing.
I have my own.
You have your own glucometer?
Yes.
Good. So you're going to measure your sugar several times during the day for me. Keep track of it, because we're going to bring this in for landing.
Okay.
And now, the other thing you've taken is the lisinopril for your blood pressure.
Right.
And do you remember what the blood pressures were upstairs?
morning it was 122 over, I can't remember.
But 120 something over something.
Yeah, I think
Okay.
maybe 66.
And you didn't take your blood pressure medicine yesterday?
No.
And your blood pressure is perfect?
Mhm.
I can't hear you.
It sure is.
So the surgery's already working, is what we think. But again, we're doing that same analogy of landing the jet with your blood pressure. So when you leave, you're going to get a wrist blood pressure cuff and check your blood pressure 3, 4, 5, 6 times a day while we watch it, while we bring that in for a landing as well.
Okay.
We can stand it if your blood pressure is slightly high during this week. We can't stand it if it's 40.
Right.
Same exact thing as your blood sugar. So you're going to monitor that, and in most cases you won't have to do anything other than just watch as we land.
Mm-hmm. All righty.
Okay?
And my last medicine is for thyroid.
You have to start taking that whenever.
Mm-hmm. Okay. So that's ongoing.
Yep.
All right.
Good. See, second was Helen? Yeah. What's the sugar reports for you? It should be high. You didn't get a bunch of insulin.
What?
It should be high.
I think it ranges from 277 to 401.
Okay. Now, what is this morning's reading? Do you remember? 270 or 400?
270.
Good. Okay, so it was 400 last night
Yes.
and kind of trending down. And you did not get your, is it 30 or 60 of Lantus at night, usually?
Usually.
Usually it's which, 30 or 60?
60.
60, okay, so you didn't get 60 last
No,
night.
I didn't.
All right. And so this morning, even though you didn't get 60 last night, it's gone down, your sugar,
Yeah.
from 400 to 277 or something like that?
Yeah.
Okay. Now, is 277 bad?
Well.
It's
in the
not
long
bad
run-
today.
in the
Long run,
it would be
absolutely.
bad.
If you would have years of that, that would be terrible. So we would be upset if you're going to keep that. We don't think you're going to keep that. What we hope and pray and expect is with the new bypass, we've increased those insulinogenic hormones, the glucagon-like peptide and GIP, and so we hope to help bring it down. Now, because you brought more baggage, your diabetes is more severe, because if you're taking 60 of Lantus every night, your body requires quite a bit of insulin help, as compared to somebody who's taking just one tablet of metformin. So, during the day today, we want to watch what's happening and then begin to plan for tonight's dose of Lantus.
Okay.
So what we'd like to know for deciding about tonight is, are your sugars going to be 400s all day, or are they going to be going from 270 to 250 to 200 today? If they're in the 200s today, then I wouldn't take your full dose of Lantus tonight.
Okay.
Because tomorrow, with the surgery and your usual dose of Lantus, we might get some 40s.
Okay.
Don't want 40s.
Don't like 30.
270s, I'm happy with. Not forever, but I just don't want to drop out of the sky in this airplane that we're driving.
Okay. Does the dextrose strip have anything to do with that?
Great question. Great question. No. We want you to have sugar. The brain needs sugar. Some people get confused and say, oh, we'll just run the diabetic with no sugar. The solution is to give a little bit of sugar and some insulin. We're going to cure your diabetes over time. The solution is not to deprive your brain of sugar, it's to give a little bit of sugar and insulin to put sugar into the brain cells. If you take the brain of a diabetic and don't give it sugar, it's like the brain of a non-diabetic without sugar. Insulin is necessary to put sugar in the brain, and you have to have that. So the solution is not to give the diabetic zero sugar. You need sugar. Not tons, but you need some sugar and some insulin to put it in. The amount of sugar you get in an IV bag over a day is, what, 50 calories. But that little bit is good for you and your brain. When I used to teach my residents, they used to solve the problem of a diabetic by taking away all sugar. And there are times when you get profound brain damage with no sugar. You need some insulin and a little sugar to put some of that sugar in the brain to make you okay. You don't want to solve it by taking away all sugar. You want a little sugar and a little insulin. And you haven't been getting tons of calories over the day. You know how to calculate calories, right?
Right.
So how many calories do you think you got yesterday?
Very little.
Right. So your sugar is still high, even though you got very few calories. So the solution to that is not to pull away the little bit of sugar you got, because your brain lives on sugar. And so you need some of that.
Okay.
But a lot of our diabetics, that's a good question, a lot of our diabetics say, well, I don't want to drink the Gatorade because it has sugar in it. Well, that's true, but what we want to do is drink the Gatorade and take a little insulin. Your surgery, let's comment. 27 minutes, and we bypassed 5 feet, and mild fatty liver, and everything went smoothly.
Okay. How much of a stomach did you eat?
It's a lot like their stomach, is just slightly wider.
Okay.
So I think you got what I thought was going to be a good match for you and your weight and the diabetes. So we tried to modulate that perfectly, but it's kind of like a golf shot. It's kind of a guess. It's a judgment, and we hope it'll be a good match for you.
Okay.
How was your night?
Pretty good. You woke me up at 12 for vitals and had to go to the bathroom and took a tour of the floor and came back.
And we all met in my room, but you were asleep.
Any questions?
I don't think so.
Okay. The key thing is going to be us monitoring your sugars. And if I were guessing from the 400, 277, I'm guessing that tonight is 30 of Lantus.
Okay.
And the reason is the total caloric intake you're going to have is small. So the old days, your usual days before, you would eat roughly how many calories a day? 2,000 or 3,000?
Hope not.
Well,
Okay, 2.
okay, say 2,000, whatever. I mean, so you would take 60 units of insulin at night, and then you'd have to supplement during the day with 20 or 30 units, you said,
Novolog.
of Novolog. So you're getting around 90 to 100 a day, rough, on most days, depending on whether there's cheesecake in there or not, right?
Right.
Yeah, that's okay. Right. And so now we're going to say your total calories projected today, just think about it. Not many. Okay. So if we give you the usual dose of Lantus tonight, could be trouble. So we're going to turn it down. Now, if your sugar tonight is 460, then we might give you a little bit more of that. My guess is it's going to trim down. It might be 250 to 300 tonight. And then we'll give you the Lantus to put some of that sugar in. You'll keep taking the Gatorade with a little bit of sugar. Tomorrow we'll see maybe a couple days of 30 of the Lantus, which is half of what you usually take. And then we'll probably go to 15 and then skip it and just start doing on regular doses during the day. That's a rough guess.
Sounds good.
Sounds pretty exciting, yeah.